Welcome to Latchkey Legends. I'm Santanu Rahman. My guest today is Dr. Sharad Kohli, a doctor of family medicine. Dr. Sharad Kohli, you're also a good friend, and it's really weird for me to say doctor, but you are a doctor.
It is weird for me to hear you say doctor.
So, welcome to this show. Thank you for being on here. This is all about Generation X, and particularly people who have just turned 50, because that is what qualifies someone to be considered a senior at the city of Austin.
You're making me feel old right now.
And so you recently became of this age. And one thing you told me, this is why it's great to have friends who are doctors. Like, I never understood why in the world was 50 chosen as the year. Do you remember what you told me?
I don't, because it might have to do with some medical guidelines, but those have changed, I think. So,
well, you said that's what AARP goes by.
Oh, yes, that is correct. That is, but they started sending me stuff as soon as I turned 50.
Right. So maybe it was just basically trying to align or line up with that.
Maybe. I have no idea if that's really the case. But AARP, I think, is just trying to market it, and maybe that's they just have. 50 is a nice even number too.
Yes, yeah. Well, it's really fascinating, your story as a medical doctor, because to me, in many ways, you really exemplify the Gen X kind of ethos and mindset in your approach to medicine. I would not call you a typical doctor. You do a lot of what I guess the word is, and please correct me if I'm wrong, more integrative health.
Mm-hmm, correct.
Can you talk about what integrative health is?
Yeah, I mean, integrative health it's sort of a broader concept. Originally, I think people used to say like complementary medicine, and before that was alternative medicine. But the idea of integrative is taking the best of all the different healing traditions out there. So you may look at Western medicine, and that's what I'm trained in. But at the same time, there are other healing traditions that have been around for thousands of years. And so, you want to try to integrate those in to sort of meet your patient's preferences and what might be best for them. So that might include yoga and acupuncture, a lot of nutrition, lifestyle changes, might include like homeopathy. It might include a whole host of things, chiropractic, but you basically just trying to you work together with a lot of times those practitioners so it's more of a multidisciplinary team approach to health in a lot of ways.
And I think that idea is so it really reflects a lot of the Gen X ideology in terms of like we sort of draw from so many different influences and inspirations to create our essence, right?
Mm-hmm.
It's very hard to just be like, yeah, I am this one thing, and it sounds like integrative health is all about pulling kind of the best things from the best practices.
Yeah, correct. Yeah, I mean, it's funny because I have a friend who we were looking at labels and calling things, is this integrative health or is this complementary health? And he's just like, what is it? What is it? Integrative medicine? He's like, no, this is just good medicine.
Yeah.
It's just like you're doing what's best for the patient. Like right. You're going to look at all the evidence and all the different traditions that are out there and figure out what works best for them.
Yeah.
And so, yeah.
I love that. And so our generation, Generation X, talk to me a little bit about what might be some health issues and challenges kind of unique to our generation. I mean, we grew up with a lot of sugary cereals.
Yeah. Yeah. I mean, I think, I don't know if it's necessarily different with our generation as other generations, because I think as soon as you hit a certain age, people start getting a lot of chronic illnesses and different things that you have to screen for.
True.
I mean, I would say, once you hit 45, there's obviously recommendations for colon cancer screening, mammograms for women at 40, so like those are like the basic cancer type screenings. But I mean, you start seeing people develop hypertension, diabetes, And a lot of it's stress related type illnesses as well, depression, anxiety. Those I think have been common for a long time amongst people.
Yeah.
And I don't know if I can correlate it to our generation specifically, like,
Sure.
like in terms of, the growing up and, like in this sort of nihilistic, apathetic, sort of like, listening to grunge music and like, oh, everything sucks, but yeah, I think it's just natural. I mean, obviously the world is changing too.
Sure.
And there are more stresses in the world. It's harder to move. I mean, I think it's also like, as you get to our generation, we have kids, or we have, parents we have to go take care of. It's a lot harder to take care of yourself in that era, right?
Yeah.
So it's harder to say like, I'm just going to go and exercise and every day, or sometimes you're not eating the best, things like that, and then all the stress adds up too. So,
how important is that stress factor? Like, picture this: someone has the best dietary habits in the world, maybe even vegetarian, and they have a very strict, regimented exercise program that they do diligently every day.
Yeah.
And yet they have health problems.
Yeah. I mean, stress is sort of the key factor in my mind for what leads to poor health. And we know this through a lot of science and data around cortisol levels and sort of what we call the allostatic load, where basically there are changes in your chromosomes and there are changes in your body when you're exposed to chronic daily stress. This is often seen, like especially like if you look at like people of color and look at chronic racism and the effects of that actually plays a huge role and that's why a lot of different groups end up with like inequities in terms of health outcomes, in terms of health disparities, I guess.
Sure.
And so, but the chronic stress, if you're experiencing that on a regular level, you're basically, your cortisol levels go up. You're kind of constantly in this fight or flight response. When your cortisol levels are up, you're basically creating inflammation and damage to your cells. And as a result, you'll end up with things like high blood pressure. You'll end up with potentially diabetes, chronic disease. Most chronic diseases have a level of inflammation that contribute to it. And so, one of the big things is that, you have to move out of that kind of chronic fight or flight situation into sort of that opposite with the parasympathetic, rest and digest. And so figuring out ways to sort of address that daily stress is really important to helping yourself. I mean, yeah, and eating right and exercising, all that's great, and that's important. But if you still are dealing with constantly all this stress, you are going to still potentially have health problems.
Yeah, I love that little rhyme scheme you just threw out there. Rest and digest. That's going to stick. Yeah, rest and digest.
Yeah, fight or flight. Rest and digest. That's the easiest way to remember, right? Yeah.
That's a really interesting outtake. And I forgot to mention that another big part of your work, as you were talking about, it just dawned on me. You do a lot of work for underserved medical, like people with underserved needs medically. Can you talk a little bit about what you did in that regard? What you do in that regard?
Yeah. So I'm a family doctor by trade. So and I. Really, since I've been out of residency, I've primarily worked in federally qualified health centers, and they're also called FQHCs. It's the largest network of clinics in the country, actually. Serves over 30 million people. Wow. And these are independent nonprofits. So they're all different, and that they're just connected in that they all receive federal funding to take care of really anyone who comes through the doors. So you may have private insurance, but they take predominantly a lot of Medicaid, Medicare, and folks who don't have insurance, and they often have to work on a sliding fee scale for that. You do primary care, behavioral health needs are met, and then oftentimes dental care, and sometimes in some clinics, like in our clinic, we can offer acupuncture and yoga and other nutrition services and things like that.
This is phenomenal, and I think that it's something that's so desperately needed because it seems like healthcare is a major issue in our country, and so how much of what you do is just letting people know you exist, because is that a challenge, an issue? Like, hey, do you guys know we exist? You know?
Yeah, I mean, all the time. I mean, so many physicians and other healthcare people in this country have no idea what FQHCs are. I go to conferences, or like physician conferences, and like talk about FQHCs, and people are like, "What is that?" And I'm like, "Yeah, it's like this huge network that's out there." And I think part of it is, I mean, it just speaks to the two-tiered nature of healthcare that we have, right? So we have folks who have private insurance who can go to like a regular private practice clinic, or group practice. But then if you don't have insurance, especially in Texas, we didn't expand Medicaid here, so we have a lot of people who don't have access to any care.
Right.
There is a place that they can go, and so that's where FQHCs kind of stand out, in that they actually people can come there, but the quality of care in FQHCs actually is better than in the private world.
Really?
Oh yeah. If you look at actually the data around that, it's equal or above private practices.
Do you think that the reason for that is because the physicians who opt to work in that environment are people who genuinely care? They're not really necessarily all about the payday?
Well, I think that's completely true. I think that the doctors who say I want, or nurse practitioners or PAs or anyone who really wants to work there, has usually a mission, or to really for some social impact of some sort, right? Yeah. But I think the other piece of it is that FQHCs have, as part of the grant, you have to like meet certain quality metrics, and there's things that you have to follow, regulations that you have to follow, which allows you to sort of say, okay, you're actually doing what is recommended and what we're supposed to be doing, versus if you're in just your own private office, you don't have to follow a lot of those things. I mean, you have to be safe, and you don't want to get sued,
right.
but at the same time, you're not necessarily really held up to that certain standard that FQHCs are.
Yeah.
The other piece of it, I think, is that we're working with limited resources, and so I think out of that comes a lot of creativity and out of the box thinking.
Yeah.
Like for instance, we had in our clinic when I joined in 2018. We had a lot of people who had chronic pain. I mean, just like you'll see in most places, but especially in our clinic, in any underserved environment, people who often had a lot of trauma, and the chronic pain we see isn't always physical; it could be emotional, and like in the brain, there's no difference between physical and emotional pain. So we had received some funding to sort of work on the opioid epidemic and like try to get people off of opioids. We didn't have a lot of people on opioids, but we're like, well, we can prevent people from getting on opioids, because if they have chronic pain and the only thing you can give them is a pill and an opioid, well, they're going to probably become dependent, especially given their trauma history.
Right.
So we basically decided we're going to just come up with this pain management program that incorporated a lot of the resources which we already had, which included like behavioral health and nutrition. We had an acupuncturist already there. We incorporated some yoga, some massage. We had a medical legal partnership, so people who are like have legal needs that affect their health, like maybe they're getting evicted and that increases their stress, or immigration issues, whatever, which will obviously increase your stress and your pain. We partnered with them. So we basically just kind of pulled this program all together, just integrated them, had case conferences where we met regularly to kind of discuss complex cases. And it was really out of the fact that we didn't know how to help these people otherwise, right?
Yeah.
So I think there's just a lot of creativity and a lot of just innovation that happens in health centers. And this has been going on since the 60s when health centers came about.
Wow. When you talk about creativity, and then you reference grunge music, I want to talk about that just for a little bit, because that's another part of you that one of the reasons why we connect so well is we love music, and we love live music.
Yes.
So what was your Gen X musical upbringing like?
Oh, wow. Okay. So, I mean, in high school, I graduated high school in 92.
Okay.
So, I mean, I think like initially I was super into Led Zeppelin. I was just like obsessed with Led Zeppelin.
I'm wearing a Led Zeppelin shirt.
Oh, okay. Yeah. So Zeppelin was definitely a huge thing. And then obviously like Pink Floyd and we're like those two. And then when I think grunge blew up, I think, like the first CD I ever, not the first tape, but the first CD I ever had was like Pearl Jam 10.
Oh, okay.
Right.
Okay.
And I was in San Diego, and so everyone's like, Eddie Vedder's from San Diego originally, like, and so, and then, there was this whole thing of, and, like, I love Nirvana and Soundgarden, Alice in Chains, and all those bands. And then there was this whole thing about San Diego was going to be like the next Seattle.
Oh, really?
It wasn't, by the way.
Oh,
but I think it's because like there were some bands coming out of there, like
see.
Rocket from the Crypt, and I don't know if Pennywise was from there, from Orange County. But anyway, they were like, Stone Temple Pilots.
Oh, okay,
right?
okay.
But it was so close to LA that like all those bands went to LA, and we're just like, no one's going to stay in San Diego.
Right.
So, but anyway, so grunge was like a big piece of it for like that early stage, especially up until college, and then I think like I kind of started venturing off into other areas, like into I think I went to college in the Northeast, so I had a friend who was really into Phish, so I like learned about Phish, and then that took me into jazz, and then jazz took me into hip hop, and then so I kind of just like gone through all sorts of different genres.
And when you were into groups like Phish or what have you, Grateful Dead, or it's really like not just the music itself, but also the live music experience.
Yeah. I mean, Phish very, very much is. I was never a big Grateful Dead fan. I never, saw them.
Some of my friends were totally Deadheads.
Yeah. I mean, but I would say the first show I ever went to was Lollapalooza in, I think it was 93.
Oh.
So it was so the first live band I ever saw was Rage Against the Machine.
Wow.
And I was just like, oh my God, I got to do more of this, right?
Live music.
Yeah. Then it was like Tool, and then there was like, who else was there? Like Primus, Alice in Chains, Arrested Development.
That was all in the Lollapalooza?
Yeah, on that Lollapalooza, wow. Yeah.
So I think I saw Lollapalooza in 94, 95, and who I saw were Smashing Pumpkins, Beastie Boys, L7, if you remember them.
Yeah, of course.
Parliament.
Yeah, Parliament was there?
Yeah, because they did this kind of revival in the 90s.
Yeah.
But Smashing Pumpkins and Beastie Boys were sort of the big ones.
I was really it's funny because I was actually listening to the Beastie Boys on the way over here.
Oh, really?
Because on the radio the other day, there's that one song that the Beastie Boys did with Santa Gold. That on Hot Sauce Committee Part 2. So that came up, and so I'm like, I haven't listened to this album in a while, and so I put it on. So I was actually listening to it coming over here.
Wow.
So, but I went to those Tibetan freedom concerts in San Francisco when they put them on, and that was just like a ridiculous lineup with like it was like Smashing Pumpkins, Chili Peppers, Beastie Boys, Rage Against the Machine, like John Lee Hooker. Buddy Guy, Beck, Bjork.
Wow.
I mean, you can just go on and on
Holy
and on
smokes.
over 2 days. It was it was crazy.
Yeah. I mean, you've probably seen all the greats when it comes to that.
I mean, not all, but I'm gonna keep trying.
Yeah, that's pretty awesome. Do you play any music? It just seems like maybe you play music.
I don't officially play music. Okay, but when I was in the Bay Area, I kind of had a fake band.
Yeah.
And so like I had a couple friends, and one of them this is before kids, right? So
of course.
So they lived in our friends Mary Beth and
yes,
Eric,
yes,
right? Yeah. So they went to medical school with me, and they lived in San Francisco, and I lived in Oakland, and we would come over and go out to the bars and just hang out or whatever we're doing. And then at like 2:00 we'd go back to their place, and he had like a music studio basically in there. And so we'd had a few drinks, and we're just like, let's play music. And we played till like 4 in the morning, 5 in the morning, and we'd play, and we'd be like, oh yeah, man, this is great. This is so good. Like, if we just practice for 6 weeks, we could get a gig in the Mission District. Yes. And we were like, all right. So then, we wouldn't see each other for a few weeks or whatever, and then we'd hang out again, and then we would go back to the room and start playing again. It's like, dude, again, 6 weeks. If we 6 weeks, just practice, we could get a gig in the Mission. So our band became 6 weeks from the Mission.
Nice.
And basically we created a Facebook page, and we created had some pictures. It's still up on Facebook. You can find
That's wild.
But we never. I mean, we recorded like one song. We never played a gig. We just kind of were fake. I just played percussion. I mean, So I'm like more, just like like djembe or like bongos or whatever.
That's awesome, though.
And so my other friend played guitar, and the other one played bass.
And you're all doctors?
One of them was a doctor,
Okay.
and the other one wasn't.
Oh, okay,
Yeah,
okay.
yeah.
Because it sounds like when you went to medical school, you were with a group of just the most, I guess, eclectic personality types to become doctors. Not what, and this is something another avenue we can talk about, because you and I are both South Asian American or Indian American, and in Indian households, there's sort of this expectation, you must be a doctor or engineer kind of thing.
Right.
I mean, you certainly did become a doctor, but probably not the way that most...
No, not the way that my mother had hoped. I think she wished I were a gastroenterologist or a cardiologist of some sort.
Talk about that.
Yeah, I mean, it's interesting because, like my mom is a physician and she's a pathologist. But then, when I was born, she decided not to work and raised me, and then my sister was born, and I think she initially intended to go back to work, but that never ended up happening. So I mean, it's interesting, we were talking about this, the Latchkey Legends, right? Like we were never really latchkey kids because like my mom was always home. I mean, like she was working at home. Like I'm clearly working, right? At home, right? And not like doing doctor work, but doing household stuff, which was very important for us. And so like I mean, I was always able to get picked up, or someone was at home. I didn't have to like get the key out from under the mat and open it up.
Right.
But I think because she never was able to really practice, and given the sort of the stereotypes of what people would expect of their kids in the South Asian community, I think she wanted me to be a doctor. Like she was vicariously probably living through that idea of me becoming a doctor. And so everything, I think it sort of became like, it wasn't that I was like, oh, I want to be a doctor. It was just like, I guess I want to be a doctor. Like maybe like there was a little bit of suggestion happening even from a high school on.
Right.
And so when I went to college, it was like trying to figure out like what major I can do that would get all the pre-med recs done or whatever, right? The prerequisites done for the pre-med, right? And so and it may not have been what I really wanted to do. I don't know. Like I actually really liked history, and I liked different humanities, and was interested in a lot of that stuff. But I ended up being a biochemistry major, or whatever, right? And so I mean, so I ended up like applying, getting into medical school. And I went to medical school at the University of Oklahoma. So it's, all your fellow the Texas folks here may not be happy about that, but Boomer Sooner. And so it was interesting because like when I went there, part of what OU's focus on in medical school is getting people to come back to small towns and practice as family doctors, because there's a shortage in the rural communities, especially, which everywhere there's a shortage in rural communities. So they really emphasize family medicine. So I did like a rotation my first or second year, where I went out to this small town of like 2,000 people, and there was this family doc, and he was like running the hospital and doing all the deliveries, and he was doing surgeries, which is like unheard of for family docs to do, like appendectomies and things like that. And he was like running the ICU, and I was just like, wow, this is really cool. Like this is what a family doc can do. And I'm not the type of person I think that can really focus on just one thing and just do that over and over and over again. Like I like the variety of seeing someone with diabetes, and then someone with chronic pain, and then maybe there's a well woman exam, and then there's a well child 4-month-old, or whatever, just like you get like then a geriatric patient, so you get like everything, right? And I like that, and so I decided to do family medicine, and I ended up going out to Oregon, where they had a rural family medicine training program in this town of like 30,000 called Klamath Falls, and there like you are like the doctors in the hospital. Like there are some specialists, but you're taking care for the most part of all those patients. You get really good training. So anyway, so I ended up going that route, and I mean, it's great. Like, I mean, the nice thing about family medicine is you can pick and choose what you're interested in and just focus on that, because you're trained in everything. Right. And so like I have some friends who only work in the ER, and I have other friends who only work in the hospital, and others who just see everybody. Right. So, and some who deliver babies, and but yeah, for my mom, it was sort of like, like even like years after I finished training, she's like, "Well, so when are you going to specialize?" I'm like, I did special. Family medicine is a specialty. I've already done that, and so I think like I think they've grown to accept it and understand what I do now. But I think it was still sort of this a little bit of a little bit of disappointment that I didn't go into like one of the higher paying, higher status specialties. Probably
be a cardiologist.
Yeah,
that kind of thing.
Right.
Yeah, interesting.
Yeah.
It's always fascinating to hear people's journeys when it's, especially when it's a little bit off the beaten path. I love that because my own story is like that. So as a Gen Xer, films and TV are important cultural touchstones. So what are some of your favorites?
Oh, wow.
Growing up,
like you mean like in high school?
80s, early 90s kind of stuff.
That's a good question.
Maybe even some of the 70s.
Yeah. I mean, well, the Star Wars films were clearly like influential to me in a lot of ways. I mean, I still have my Star Wars toys that are in the house.
Nice.
That my kids play with now.
Awesome.
Yeah. And then that's a good question. I mean, the TV. I mean, I'm trying to remember even. It's so hard to remember.
Like, were there films like that you're like, this is the one I'm going to be watching over and over again kind of thing?
I mean, well, Star Wars was definitely that one for initially.
Sure.
But then I think, I don't know if, I mean, I started getting into like kind of suspenseful type stuff.
Okay.
I don't know. I really liked like the second Alien movie, Aliens. I think that one. I remember watching that one at like after winter formal in like senior year. I'm like, this movie's amazing. like just the first one I wasn't that into, but the second one, I don't know. It's something about Sigourney Weaver and she was just like such a badass. And then just like the suspense of it or whatever. I think I really liked.
Sure.
I don't know if it's just, I have a hard time thinking about, I mean, like I think when I got to college, Seinfeld was such a big deal, right? Like, well, I went to college in the Northeast and I would say that like half of the people in that college came from New York, probably,
right.
Maybe not that many, but like a lot of people were from New York. And so it was kind of interesting because, it used to come on Thursday at 9:00, Seinfeld, right? And like people would be studying, doing whatever. And then, like at Thursday at 9:00, everyone was watching Seinfeld.
That's hilarious.
And then at 9:30, everyone was outside talking about Seinfeld, right? Like it was just like, I mean, and it's interesting to think about it from the perspective of like watching the program at the same time, right? Like because everyone streams and you can just kind of binge and do whatever nowadays.
Right.
Back then, it's just like you had to like if you didn't watch it at that time, like you might miss it, right? Like, or you had to record it somehow.
Yeah.
I mean, I remember actually going back before that, like when I was a kid, like probably, I don't remember, this must have been the 80s. I used to watch Family Ties. I really was into Family Ties.
Michael J. Fox.
Yeah, Michael J. Fox is great. And then I remember like I was taping them because sometimes they were like on too late or something, or maybe it was when there, and I had a tape of Family Ties, and then my dad accidentally used that to tape family videos over it. So I mean, and so I went there and I was like trying to watch Family Ties, and it's like some video of like us playing in like a park or something like that, and I was so mad. I was just like, I mean, this must have been like like elementary or middle school or something. But I was so mad about that. And now that problem doesn't exist.
Right.
You could just go and stream it or whatever.
That's right.
But even like you just had to go watch Seinfeld at 9 to 9:30, and you have to watch the commercials and all this other stuff.
So in the Seinfeld versus Friends battle, you're clearly Team Seinfeld.
Oh, clearly. Yeah, clearly Team Seinfeld. Yeah. No. Which, although I will say I'm not as big on Curb Your Enthusiasm. Like, I respect it, but I just don't find it as funny as Seinfeld. And Larry David, like, after a while just kind of gets annoying to me. I think he's funny, but like he's just like there's only so much of that. Shtick, I think
there's this comedian named Neil Brennan who had a very astute observation. He said that Jerry Seinfeld he kind of has the lighthearted humor on in his presentation, but his personality is a lot darker.
Yeah.
Versus Larry David's personality is more kind of hardcore cutthroat in his presentation, but his personality is more lighthearted.
Yeah, I can see that. Yeah, I can see that for sure. Yeah, right.
The yin and yang of them.
It's
it's always interesting to know, because this is kind of how Gen Xers bonded, exactly to what you were talking about, is we bond over the kind of things we watch and the music we listen to.
Yeah.
And that creates sometimes lifetime friendships.
Right. Well, I mean, I even remember because that's true, because I remember trying to so much of my world at that point was just studying and then watching a few programs or watching some movies. And so, I think that Seinfeld, The Usual Suspects, that movie. Do you remember that? I can't talk about Kevin Spacey, but that was a really good movie.
Yeah, it was.
It was really just twists and just really suspenseful. And so I just remember that and having these conversations with people about those movies. I remember Basic Instinct.
Oh, sure. Yeah, when that came out.
Yeah. And then just just talking for hours. I think I was just really into the suspense, thriller type thing. Not gore, not horror, but psychological thrillers. I think was actually kind of got me. I was interested in that.
That's awesome. So before we sign off, I'm going to do this thing that I know other podcasters do. They have a few questions that they ask everybody, and I was like, what's the one question I'll ask everybody? And the question is, I think, what posters were in your room in the 80s and 90s?
Oh, God. Okay. What posters were in my room?
Yeah, what was hanging on your walls?
That is a good question, because I don't know if I had a lot hanging. I mean, I had a Zeppelin poster for sure.
Okay.
Yeah. That's a long time to think back to. Because it's funny because my room in my parents' house is there, but it's been totally converted in my dad's office, and it has an exercise bike, and it doesn't have any. It has still has some of my books that are there that are just in the corner, but I that's all I picture now, because I don't even picture my own room. But I think
Led Zeppelin jumps to mind.
Zeppelin jumps to mind. I probably had a Zeppelin. I probably had the Zoso, thing.
Yes.
I may have had a Pearl Jam poster.
That would track.
I probably would have a Pearl Jam poster too.
Yeah.
And then, did I have anything else? I could tell you what was in my sister's room. That would embarrass her, but I don't know if I should do that.
No, I like the Led Zeppelin Pearl Jam. That's a good.
Good those probably were the two. I mean, I don't think I had any. I mean, do I have a Soundgarden? Nah, I don't know if I did. I don't know. Those are the ones I can remember.
That's awesome. That's very cool. Well, thank you so much for coming on the podcast and chatting with me. I really appreciate your take on everything.
Yeah, thanks. Thanks for having me.
And thank you all out there for listening.